Thank you for joining this Navigating Medicare, Understanding and Exploring the Options Part 3. I am one of the benefit specialists for the ADRC of Brown County. Now we will go over Medicare Parts A and B and what they cover. We'll also talk about the different choices that you have when it comes to choosing the Medicare option that might be best for you. This slide is a great reference that shows each option that you have when it comes to picking the Medicare choice that will be best for you. In this section of the presentation, we're going to talk about options 1 and 2. Now let's talk about option 1, which is Original Medicare. Original Medicare consists of Part A and B. We will discuss Part D later in the presentation. Original or Traditional Medicare consists of two parts, Part A and Part B. This is a pay-for-fee system, and it allows you to use any Medicare-approved provider. Medicare payment amounts are set amounts based on the procedure and services provided. This is known as the Medicare-approved amount. You can go to any doctor, specialist, hospital, or other medical provider in the country that accepts Medicare under Traditional or Original Medicare. Here we have listed who is eligible for Original Medicare. Most people access Medicare when they turn 65 years old, but there are some exceptions shown here. If you've received a disability benefit from Social Security for at least 24 months or have end-stage renal disease or ALS, for example. Medicare Part A costs include premiums, copays, and deductibles. These are subject to change annually. The 2025 facts and figures are listed on the Medicare chart, which is one of the resources in your folder and located on our website. Keep in mind, 99% of Medicare recipients receive Part A premium-free. A benefit period begins the day that you're admitted to a hospital as an inpatient or to a skilled nursing facility and ends the day that you have been out of the hospital or the skilled nursing facility for at least 60 days in a row. After you meet your deductible, Original Medicare pays in full for days 1 to 60 that you're in the hospital. Here is the information on the 2025 costs for Medicare Part B. There is a monthly premium. The standard premium is $185 a month for the year 2025. There are higher premiums for persons above certain income limits, so that's important to keep in mind. There's also an annual deductible of $257 for the year 2025, and you can expect to pay coinsurance for Part B. Original Medicare pays 80% of the Medicare approved amount for doctors and other covered health services. You would be responsible for 20% coinsurance, and there is no cost for covered preventative care services. This is an example of the complexities of Medicare coverage. Here's information on coverage for hospitalization. It's important to know that if you go into a hospital, if you've been admitted as an inpatient, or if you are considered an outpatient, hospitals are required to provide you with a moon notice regarding your status if you are there for longer than 24 hours under observation. Under Original or Traditional Medicare, if you've been admitted as an inpatient, Medicare Part A will cover the stay after the deductible is met. Part B will cover 80% of the Medicare approved amount after the annual deductible is met if you are under an observation stay. This can be a significant difference in how much you will pay out of pocket, so it's important to keep in mind. Not all services are covered by Original Medicare. It's important to understand what types of services are not covered so that you're able to plan for those costs. To understand what isn't paid for by Medicare Part A and B, please refer to the Medicare and You Handbook on pages 55 and 56 for a list of services that are not covered by Original Medicare. For example, acupuncture, dental care and dentures, cosmetic surgery, custodial care, eye refractions, healthcare while traveling outside the US, hearing aids, hearing exam for the purpose of fitting hearing aids, and long-term care. All Medicare insurance, whether original Medicare or Advantage plans, must cover specific preventative care services. Some examples would include a one-time Welcome to Medicare preventative visit, the yearly wellness visit, bone mass measurements, breast cancer screening, prostate cancer screening, cardiovascular screenings, diabetic screenings, and flu shots. Also, alcohol misuse counseling, cardiovascular disease therapies, depression screening, obesity screening, counseling, STI screening, and counseling. Please refer to the Medicare and You Handbook for additional information on this. Now let's talk about health savings accounts and Medicare. Health savings accounts, also called HSAs, are accounts for individuals with high deductible health plans. Funds contributed to an HSA are not taxed when they're put into the HSA or when they're taken out, as long as they are used to pay for qualified medical expenses. Your employer may oversee your HSA, or you may have an individual HSA that is overseen by a bank, credit union, or insurance company. If you have an HSA and will soon be eligible for Medicare, it's important to understand how enrolling in Medicare will affect your HSA. If you enroll into Medicare Parts A and or B, you can no longer contribute to an HSA, so use caution. When you become eligible for Social Security at 65, you are automatically enrolled into Medicare Part A. You can continue to use the funds in your HSA for qualified medical expenses, which include the Medicare premiums, deductibles, copays, and insurance. Once your Medicare begins, your plan administrator should make sure that your contribution to your HSA is zero. If you enroll in Medicare Part A and or B, you can no longer contribute pre-tax dollars to your HSA. This is because to contribute pre-tax dollars to an HSA, you cannot have any health insurance other than a high deductible health plan. The month your Medicare begins, your account overseer should change your contribution to your HSA to $0 per month. However, you may continue to withdraw money from your HSA after you enroll in Medicare to help pay for medical expenses such as deductibles, premiums, co-payments, and co-insurances. If you use the account for qualified medical expenses, its funds will continue to be tax-free. Keep in mind, to avoid tax penalties, you should stop contributing to your HSA 6 months prior to the month you elect to start your Social Security benefits. This is because Medicare Part A coverage will be retroactive for up to 6 months if you would have been eligible for Medicare at any point during those 6 months. If you do not stop your HSA contributions 6 months prior, you will have a tax penalty because you cannot contribute pre-tax dollars to an HSA while you have Medicare eligibility. It is also important to understand if your employer plan is your primary or secondary insurance to Medicare. Next, we'll be discussing option 2, Medigap insurance and how it works with original Medicare. Medigap policies will help fill the gaps of original Medicare. Here we've listed a couple important ideas when thinking about Medigap or Medicare supplement policies. To be eligible to enroll into a Medigap policy, you must have both Medicare Parts A and B. Enrollment into a Medicare supplement or Medigap policy is voluntary, and Medigap insurance would help fill the cost gaps of original Medicare. Coverage options are going to vary based on the riders and the option that you choose. Normally, Medigap will only pay when Medicare pays for a service, except for Wisconsin mandated services. We do have a resource available on the ADRC website that details information on those Wisconsin mandated services. So you can take a look there for more information on this. Coverage does not change from year to year on a Medigap policy, and there's high portability. Medigap plans are portable because they're secondary coverage to original Medicare. Keep in mind that Medigap policies do not include Part D coverage, and oversight for Medigap policies is done by the Office of Commissioner of Insurance in each state. A couple other things to consider if you're thinking about Medigap policies. Keep in mind, if you drop the retirement or employer-sponsored option, you may not be able to get back into it. Medigap cannot be used to supplement an Advantage plan. Medigap is secondary coverage, therefore you can be denied coverage for pre-existing conditions and be subject to wait periods if you do not qualify for guaranteed issuance, which we'll talk about next. Here are the enrollment options for Medigap policies. You can enroll into a Medigap or supplemental insurance coverage plan during the open enrollment period. Insurance companies must make coverage available to you, regardless of age, for 6 months beginning with the date that you enroll into Medicare Part B. Keep in mind, if you're under the age 65 and enroll into Medicare due to a disability or end-stage renal disease, you are entitled to another 6-month open enrollment period upon reaching age 65. Also, keep in mind guaranteed issue. Certain situations allow you to enroll into a Medigap plan without underwriting. For example, if you involuntarily lose creditable coverage, you have 63 days to enroll into a Medigap plan, and you cannot be turned down because of health issues. Coverage options would vary depending on the plan and the riders that you choose. Thank you all for joining us today. Please continue following along in Section 4.